Hi, I'm Dr. Asghar Husain, orthopedic surgeon. Joining me today is Krista Consiglio-Lahti, physical therapist from Arrowhead Orthopedics. We are together going to give you a perspective, surgeon, therapist, what do you do with the sling after you have shoulder surgery? Specifically, we're talking about rotator cuff surgery. So Matt is going to demonstrate what we typically see when somebody comes in to the office after shoulder surgery. What I'm thinking as a surgeon is, are they protecting the repair, the tissues we bring down to the arm? So Krista, I want to ask you first, what are the things that you look for when someone shows up in physical therapy, which is usually about week 1, week 2? What are the things you look for in a sling, and what can we teach people to look for as a checklist to how well they can manage this sling? Because Matt is wearing this how we often will see it, which is wrong, and Krista is going to point out what are the things we need to look for.
So first of all, I want to make sure that they're comfortable in the sling, that they're not holding their arm up on their own, they're not floating out of the sling in any way, shape, or form. Right now you can see that Matt is being held in the sling by his thumb. It's not actually just supporting his shoulder. It's also putting a whole lot of pressure on his neck. His elbow is not at the back of the sling, and the pillow is all flipped half upside down, not where it should be to help control the arm and keep everything comfortable for him.
So what is your checklist if someone was asking you, what are the things that we need to do to keep the sling on the right position? How would you answer based on what we're seeing with Matt? What are the corrections we would make?
I would tell them first to start with the pillow flipped towards them. There's a half circle portion in the pillow. Have that against their ribs, a little bit lower. Their sling should be centered more or less in the pillow, or if not, their elbow should at least be at the back of the sling. So they want to have that slid back there. And then everything, this is just to prevent you from falling out of the sling. It's not to hold you in the sling. It does not have to be sucked tight to your thumb. Your hand should be able to move. I tell them during the day they can flip it, outside their thumb, grab the ball that came with it, squeeze it to keep the blood flow going. But I don't want this part holding everything. I don't want their neck holding everything. As much as I want to protect your repair, I also don't want to treat another body part 6 months down the road.
And we can often see that when somebody comes in, they're often shrugging. Matt, show we typically see that.
Correct.
When we see that, we know this is not holding on. So to reiterate the points that you just made, here Matt, if you rotate just a little bit to the side, what you're going to see that Krista just did is she rolled this in a position that is protecting the repair. Because part of this is understanding, why are we doing this? What is the point of the sling? And the point of the pillow is that when the arm is a little bit away from the body, you're taking tension off the repair. That is good. Rotate around here for a second, Matt. When this is really loose and the arm is hanging down and you're over shrugging the upper part of the trapezius muscle over here too, you're taking the roof of the shoulder and you're digging it forward, and you're now putting a lot of tension on the repair, which we don't want to do. So as Krista pointed out, we tighten this up to a point where it feels like it is symmetric. Right? I think you said this too. If we rotate around, we're looking the way Matt is standing, the shoulders are level. Are you tensing any muscles right now,
No
Matt?
tension.
So no tension at all, right? And ultimately what we're going to get to as well too is we're putting a little bit of tightness of the muscles in the back. And as you mentioned too, the elbow's sitting over here. Rotate a little bit, Matt, too. The other thing I'll sometimes say is if you're standing up against the wall, you want to have about a fist breadth. Do you agree with that?
Mm-hmm.
About
yes.
a fist in between there, because that is a natural position the shoulder blade sits on the chest wall. So when you do that, and when I see someone, their arm is kind of tucked in here, can you rotate back around as well too? And this goes right out to the wrist. You want to have this holding on enough that you're not overusing this. So the way you can test yourself is, if the sling is on and you're needing to hold and hike up the shoulder, then that is wrong. You need to adjust it. So elbow in the sling, you want to have this, the right amount of tightness, the pillow in between the body, and then you can adjust these to tolerance. Some people like this around the thumb, and I think you just do this to comfort. Is there anything else you'd add to that checklist?
Make sure that it's not too far forward. A lot of people, I feel like, want their arm here in front of their body versus kind of at that shoulder blade scapular angle.
Yeah.
When it's in front, it then makes everything else go a little crazy. It pulls the shoulder blade away from the body as well, and it's more uncomfortable. They guard a whole lot more as well.
Yep, and we're specifically talking about rotator cuff repair. So ideally you want to check with your doctor. These are specific for rotator cuff repair. Other surgeries may be very similar, but in this video, we're really looking at it in the context of a rotator cuff repair.